Subtrochanteric fractures, the proximal fragment flexed and abducted. The distal fragment is medialized and shortened because of adductors. Atypical fractures important. The characteristics of atypical fractures: number 1, beaking of the lateral femoral cortex. Number 2, transverse fracture pattern. Number 3, medial spike. Always treat with intermittent nail. Consider screening and prophylactic fixation of contralateral sites if biphosphonate therapy. Russell-Taylor classification: number 1, no extension into piriform fossa. Number 2, extension into piriform fossa. 1A, lesser trochanter intact. 1B, lesser trochanter fractured. Type 2, extension into piriform fossa. 1A, 2A, lesser trochanter intact. 2B, lesser trochanter fractures. The treatment, you can be asked about Thomas splint. Thomas splint is a 2 fixed point at ischem and knots. The measured oblique 1200 circumference of normal thigh. 120 degree of circumference of normal thigh is measured below the ischial tuberosity. Allow for swelling. Should able to pass one finger. And a Thomas splint is applied. Kendrick splint is a one which used in the pre-hospital settings. Hamilton-Russell fraction applies the concept of parallelogram. Nailing. Type 1 nail is piriform entry nail. It has a high risk of AVN. Type 2 nails are trochanteric entry nail like gamma and striker and PFNA. These load-bearing axis is closer to the tip of the closer to the hip joint than DHS. When talk about the nail versus DHS, number 1, liver arm on implant of the femur is shortened. Number 2, no lateral wall buttress is required as for DHS. Number 3, nail resist shaft medialization. So there are 3 most important things to remember. A nail will nail over the DHS. Number 1, liver arm on implant and femur is shorter. No lateral buttress required as for DHS. Number 3, nail resist shaft medialization. Technique: the canal should be reamed at least 2 mm larger than the diameter of the nail. Check rotation, varus and valgus alignment. True lateral view is important. Whether check the neck shaft angle. If cerclage wire is used, leave as much space as possible between them, 5 cm, to preserve periostal blood supply. Matre et al. 2013 Norwegian study, 12-month postoperative period with transverse and reverse oblique fractures, subtrochanteric fracture operated with DHS had higher operation rate compared to those operated with nails. Complications: varus malpositioning, non-union, ARDS. No difference between the reamed and unreamed nail when you compare it with the ARDS.